The European Connected Health Alliance was started about 10 years ago by me, mainly because I was frustrated by the fact that so many good things happen in the world. But the reality is the people who are making them happen don't know each other and do not connect. Our mission is to break down silos. Our mission is to connect dots of people and organizations and to do good by doing that.
Ecosystems. I can remember going to my first one 10 years ago in Manchester, in the UK. Our network's expanded over the last 10 years, and now we have a network of over 70 ecosystems, but they still have the same guiding principle of leading with a need, breaking down silos, matching need and solution, transforming healthcare, and also creating economic opportunity. What we've seen over the last 2 years is our ecosystem network double. We've seen ecosystems open up across the globe in Australia, in Latin America, and Canada, and in India.
The Digital Health Society is a legacy of the Estonian presidency of the European Union in 2017. We work with presidencies and stakeholders who want to promote digital health products and services, and we focus on health data and health data management. Our three main activities are: 1, an annual summit where we promote innovation, expertise, and challenges. 2, multi-stakeholder roundtables of experts to deep dive into these challenges. 3, we support international coalitions and collaborations to transform health and care.
When it comes to the innovation team of the ECHAlliance, our work focuses on the three key areas. We support implementation of innovative digital health solutions within health and social care systems. We generate societal impact for citizens while improving global health and well-being. And we design and implement innovative projects. Currently, we have 9 ongoing projects that engage some 100 organizations from all around the world. We cooperate with pharma companies, policymakers, academia, tech providers, and other stakeholders from the demand and supply side.
When the global pandemic hit March or so in 2020, we decided that a global pandemic needed a global response. What can we do about that? We set up the Global Health Connector Partnership by connecting to like-minded organizations in places like Latin America, in North America, in Africa, in India, Australia, across the world and in Europe. That's how you do good. We intend to keep doing it.
The European Connected Health Alliance is a member organisation, and over the last 10 years our membership's grown to a size where we've got now over 860 organisations that have joined us. The majority of these are public bodies, not-for-profits, hospitals, etc. What that enables us to do is bring in groups, large groups of members, whether it be the 260 universities, the 120 hospitals, the 80 patient groups, the local government organisations, the clusters, to bring them together and bring them together using our ecosystem network to collaborate together. Membership is a vital part of the European Connected Health Alliance's community.
When I joined ECHAlliance over 10 years ago, we were just a small team of 3 or 4. Over the last 10 years, we have grown. We now have over 20 international team members from Finland, France, Spain, Slovenia, Portugal, and the UK.
Since 10 years we have created the ECHAlliance, we have seen changing a lot the digital health. It has evolved, it has transformed, it's now more mature than it was before. This is the fruit of the work of health professionals, of patients, of researchers, of industry players, of startups, of policymakers. All these stakeholders have produced a massive amount of articles, green papers, white papers, reports, and a lot of content that is difficult sometimes to find out the information you're looking for. This is why we have created the Digital Health Observatory. The DHO is a professional service of ECHAlliance to provide you with qualitative content every day.
In the last 10 years, the world has changed, and so have we. We have adapted how we communicate and how we interact and engage with our community by creating specific newsletters, using different platforms, and also the way we organize events. The pandemic forced us to learn how to organize virtual events successfully, as we did for the last Digital Health Society Summit. But we are glad to be back to normality. And our flagship event, the Digital Health and Wellness Summit, was once again held in person during the 2021 Mobile World Congress in Barcelona. And after several editions, is still going from strength to strength.
Over the last 10 years, we have built an organization, a methodology, a process, including our ecosystem network. We've been assisted in this by our partners, our community, and our friends around the world. We have a lot more to do, but we now have the ability to connect the dots. We have the ability to take on tasks which are globally necessary and to deliver real solutions. So though we've had 10 years and we're 10 years old, we have a lot more to do. So I'm really looking forward and excited about the next 10 years as well.